Okay, if you're getting ready for the NCLEX, you totally know this feeling. A question pops up, and somehow every single answer looks right. But here's the thing. The key isn't just knowing the nursing process, it's knowing the key words that unlock everything. Today, we're going to break down the ADPIE Keyword Navigator, your new secret weapon for those ridiculously tricky questions.
Right? We've all been there. You're staring at a super complex scenario, your heart is pounding, and every single option seems plausible. It feels less like you're using your critical thinking and more like you're just guessing on a lottery ticket.
But what if I told you that you don't actually have to guess? Seriously, the NCLEX plants little clues in every single question. And ADPIE, well, ADPIE is your decoder ring. It's the system that helps you cut through the noise and navigate straight to the correct answer. All right, let's dive right in with the first two steps, assessment and diagnosis, because this is where a lot of people get tripped up. Just think of it like this. One is about seeing what's going on, and the other is about naming it. The NCLEX absolutely loves to test if you know the difference. Okay, first up, assessment. This is your foundation. The single most important idea to burn into your brain here is gathering information. Before you can do anything, before you can even think about a problem, you have to look and you have to ask. It's pure data collection. And these are your magic words. When you see keywords like assess, check, monitor, or obtain history, these words should be like a giant flashing neon sign in your brain. They're all asking the same basic question. What is happening right now? So once you've gathered all that data, you move on to diagnosis. This is where you play detective. You take all that information from your assessment and you start analyzing it to figure out what the actual problem is. You're giving it a name. Think of this step like a funnel. You're taking all that raw data you collected, the vital signs, the patient's history, and you're analyzing it. You're looking for patterns, for connections, anything to identify the core problem. This is where you might flag a risk for something, moving from just observing to actually interpreting.
So, here's the bottom line. The big takeaway. Is the nurse gathering information? That's assessment. Is the nurse labeling or naming the problem based on that info? That, my friend, is diagnosis. It really is that simple when you see it side by side.
Okay, you with me? Let's move on to the next dynamic duo, planning and implementation. With this pair, we're shifting from thinking to doing. You can think of it as a difference between creating the game plan and actually playing the game. Planning is all about looking ahead. It's the strategy phase. You're asking, okay, what is our goal here? What do we want to happen? This is where you set those desired outcomes and figure out the best steps to get there. The keywords here are all about the destination. Seriously, think of it like planning a road trip. The goal or outcome is your destination on the map. The turns you need to take, that's your plan of care. If the nurse is busy charting the course before the journey starts, you are deep in the planning phase.
And then, of course, comes the fun part, implementation. This one is super easy to remember because it's the doing phase. All that awesome planning you did, now it gets put into motion. This is where you, the nurse, get to take direct action.
And the key words for implementation are just boom, all action verbs. You can see it right there. You're administering medication, performing a dressing change, teaching the patient. If the nurse is actively doing something to or for the patient, that's your answer. You've found it. So let's lock this concept in right now. If the nurse is deciding what should happen in the future, that's planning. If the nurse is actually doing something right now, that's implementation. Knowing this distinction is absolutely golden on the exam. Okay, so we've gathered the data, we've named the problem, we've made a plan, and we've taken action. So we're done, right? Not even close. Now comes the most important question of all. Did any of it actually work? This is evaluation. Think of evaluation as the quality control step. You've done something, and now you're circling back to check on the result. Was your intervention effective? Did the patient's condition get better? Did we actually hit the goals we set way back in the planning phase?
The keywords here are all about checking the results. It's a feedback loop. You're looking at the outcome and asking, was that a thumbs up or a thumbs down? And look, words like reassess are crucial here. Notice, this isn't the initial assessment, it's a reassessment to see if what you did worked. You're checking to see if the goal was met.
So let's boil it all down. The NCLEX clue is this simple. You see an action happen, like giving a medication. If the next thing the nurse does is check to see what happened because of that action, you are in the evaluation phase. It's that straightforward.
All right, you've made it this far. The concepts are starting to click, but how do you make this all stick when you're under pressure, staring at that exam clock? Don't worry, I've got one final, super simplified memory trick that's going to tie this all together for you.
Here it is, your super NCLEX memory trick. Forget all the complex definitions for a second, and just remember these 5 words. A is for ask, you're gathering data. D is for decide, what's the problem? P is for plan, what's our goal? I is for intervene, let's take action. And E is for examine results. Did it work? Ask, decide, plan, intervene, examine. That's it. That's the whole thing.
And that's it. That's the secret. ADPIE isn't just some boring process you have to memorize. It's a powerful tool for totally decoding those NCLEX questions. You have the key in your hand. The only question left is, which questions are you going to unlock first? Go get them. You've got this.